This lecture focuses on Chapter 15, the Autonomic Nervous System. What is the autonomic nervous system? Well, it controls the smooth muscles, the cardiac muscles, and the glands. It is under involuntary control. It's highly reflexive. The autonomic nervous system is divided into the parasympathetic and sympathetic divisions. The parasympathetic nervous system activates during the resting and digesting phase. The sympathetic nervous system activates during the stress response, known as fight or flight, and you can add freeze. So homeostasis is a dynamic balance between the autonomic branches of parasympathetic and sympathetic. The sympathetic ganglia are located in the thoracic and lumbar region of the spine, and they are thus called thoracolumbar. The parasympathetic ganglia are located in the cranial nerves and the sacral region of the spine, and are thus termed craniosacral. This slide shows the differences between the sympathetic structure and the parasympathetic structure. In the sympathetic division, neurons originate in the thoracolumbar region of the spinal cord, and they have short preganglionic and long postganglionic axons, and the ganglia lie close to the spinal cord and are often called chain ganglia. In the parasympathetic division, neurons emerge from the brain and the sacral region of the spinal cord. They have long preganglionic and short postganglionic axons, and most ganglia are located in the actual visceral organs. On the left, you see the parasympathetic division. The cranial nerves are coming from, looks like, this area here, particularly the brain stem. It's a little off scale, but that's supposed to indicate the brain stem. And then this is your vagus nerve. And then here's the sacral part of the craniosacral. And then with the sympathetic, you can see that it's the thoracolumbar. So it's going to go through the thoracic and lumbar regions of the spinal cord. And they have what's called dynamic antagonism. So they're going to do opposite things. For instance, the parasympathetic is going to constrict the pupil, whereas the sympathetic dilates. So you know someone's stressed out when their pupils are dilated. The parasympathetic will stimulate the tear glands, whereas the sympathetic will weaken the tear glands. There's no effect on the tear glands. Excuse me, I was looking at weak underneath. And then for the parasympathetic, strong stimulation of salivary flow, whereas here's where there's weak stimulation of salivary flow in the sympathetic division, so you get dry mouth. And then as far as the organs are concerned, the parasympathetic division will inhibit the heart, and so keep you at a regulated heartbeat. It will dilate your arterioles. It will constrict your bronchi, so slower breathing. It will stimulate stomach motility and secretion, stimulate the pancreas, and stimulate intestinal mobility. So this is going to be all very effective for your digestion. It's also going to contract your bladder so you can go urinate. And then with the sympathetic division and the organs, you see that the sympathetic will accelerate the heart and constrict the arterioles, so it'll increase heart rate and blood pressure. It will dilate the bronchi, so more heavy breathing. It will inhibit stomach motility and secretion. It will inhibit the pancreas. It will inhibit intestinal mobility, because digestion and absorption is not the primary concern right now. It's response to the stress. And then it will relax the bladder so that you're not really focusing on the need to go urinate. You could deal with that later, right? You're stressed out. And then as far as the genitals are concerned, the parasympathetic is necessary to stimulate erection of both penis and, clitoris. And then the sympathetic division is going to be necessary to stimulate orgasm, ejaculation. All right, now let's look at the differences in the functions. So I just kind of went through that, but like with the sympathetic, it's fight or flight. So it's in charge during emergency or threatening situations. and the temporary or non-essential activities are postponed for that moment. Whereas the parasympathetic functions as resting and digesting, keeping the body energy use as low as possible, and it directs vital housekeeping activities and should be in charge most of the time. Let's look at, those features of the parasympathetic nervous system once more on its own slide. So neurons are going to emerge from the brain and the sacral region of the spinal cord, hence craniosacral. The ganglia are located close to or within the visceral organs, and thus they have long preganglionic neurons and short postganglionic neurons. And both neurons in this chain are going to secrete acetylcholine. It should be in charge most of the time. And the vagus nerve, cranial nerve 10, controls the parasympathetic activation of visceral organs and glands. And here you see again the craniosacral nerves and their ganglia and what they go out and innervate. And take special notice of that vagus nerve. Oh, and to illustrate the long preganglionic, because that's in the darker purple there, see how the preganglionic axon is very long, and then the ganglia, are going to be where the two neurons synapse, and then the postganglionic neuron will be rather short and might even actually be in the visceral organ itself. And both those neurons will secrete acetylcholine. Here are the features of the sympathetic nervous system again on its own slide. The neurons will originate in the thoracolumbar region of the spinal cord, and the ganglia will lie close to the spinal cord in a chain-like pattern. And thus, we will have short preganglionic and long postganglionic neurons. The preganglionic neurons will all secrete acetylcholine, but the postganglionic neurons will secrete either norepinephrine or epinephrine, and it could even be and then it is in charge during emergency situations. The effects of the sympathetic nervous system are immediate and systemic, like you get goosebumps all over your entire body. And the temporary or non-essential activities are postponed. So that systemic activity is called mass activation. The axon emerging from the ganglia travel within the spinal nerves and innervate all regions of the body simultaneously. And there's your goosebumps example. Exercise or fear can stimulate changes in many organ systems. And the sympathetic stimulation of the release of adrenal medulla hormones innervates the entire body. And this illustration is showing the thoracolumbar part of the spinal cord along with the ganglia and the organs that they innervate. And notice that the ganglia are close to the spinal cord. They're even closer than what this illustration shows, and they're like a chain. So the preganglionic neurons are going to be very short, and they're all going to secrete acetylcholine. And then the postganglionic neurons are going to be very long, and they will secrete, norepinephrine and or epinephrine. Or in some cases, they can also secrete acetylcholine. We should get into that in a second. Yeah, here we go. So here are the major neurotransmitters. Acetylcholine is released by cholinergic neurons, and all autonomic nervous system preganglionic axons release acetylcholine, so all of them. But in the parasympathetic, the postganglionic axons release acetylcholine. There we go. That's what I was getting at earlier. And then epinephrine and norepinephrine are released by adrenergic neurons, and those are going to be from the sympathetic postganglionic fibers, and they are very similar neurotransmitters. There's norepipen, which is the norepinephrine, and there's EpiPen, which is the epinephrine. And I wonder if that illustration is in here. No, but there is some sometimes I have seen where the sympathetic nervous system will release acetylcholine from the postganglionic. So again, sorry I keep going back and forth with that, but these are just the general rules I'm just getting a little bit too specific. So I digress. All right. So let's look at norepinephrine. That's the most common neurotransmitter in the sympathetic nervous system. It increases and maintains blood pressure and is important in what we call vascular tone or vasomotor tone. So at all times, you should have some kind of blood pressure, right? Because no blood pressure, shock and death, and just can't exist in a living body. And so vasomotor tone is going to be that like baseline blood pressure that helps to make sure that blood is being proactively pumped, to all the necessary regions of the body without causing damage. And norepinephrine is important in that. Epinephrine acts as both a neurotransmitter and also as a hormone when it is made in the adrenal gland. It is known as adrenaline, and it will stimulate insulin secretion and the release of glucose into the blood. Epinephrine will speed up heart rate, and it will dilate the bronchioles of the lungs. These are the cholinergic receptors, nicotinic receptors, and muscarinic. And these are named after chemicals that they can also bind to, like nicotine and muscarine. Nicotine is from the tobacco plant, as you know, and muscarine is from mushrooms. So the nicotinic receptors are found in the skeletal muscle cells and the adrenal medulla, and acetylcholine binding effects is excitatory in a nicotinic receptor. In a muscarinic receptor, it's found in the parasympathetic effector organs and a few sympathetic effectors, as I had mentioned earlier. There's a few sympathetic effectors that will respond to acetylcholine. And so the effects of the muscarinic receptors are either excitatory or inhibitory. Adrenergic receptors include alpha and beta. So alpha receptors are found in the arteries, and you can remember A for arteries. And with norepinephrine, that increases and maintains blood pressure. And again, it's important in the vasomotor tone. And then with the epinephrine, it stimulates insulin secretion and the release of glucose into the blood. Then we got beta receptors, and these are found in the heart and the bronchioles. So you can remember B for heartbeat and breathing. It's stimulated by epinephrine mostly, but it will also respond to norepinephrine. There are beta-1 receptors that speed up the heart rate and beta-2 receptors that dilate bronchioles of the lungs. So now you know why beta blockers are prescribed to patients who have like tachycardia and arrhythmia. An EpiPen is useful for allergic reactions. It will increase the blood pressure and heart rate and dilate the bronchioles in the lungs, allowing for your patient to start breathing again. Albuterol will dilate the bronchioles in the lungs without increasing the heart rate, and then beta blockers will decrease the blood pressure and the heart rate. Most visceral organs will have dual innervation, and as mentioned earlier, that is called dynamic antagonism, and it allows for that precise control of visceral activity. One system is usually in control of the other at any given time, but they will work in cooperation. So for example, the sympathetic nervous system responds to stress, increases the heart rate, dilates airways, and inhibits digestion and elimination. It innervates the vascular system, keeping the blood vessels in a continued state of partial contraction or constriction, thus controlling the blood pressure. And as mentioned, that's vasomotor tone. And then the parasympathetic nervous system, when the emergency is over, it restores the heart rate and the airway diameter to resting levels, and then attends to processes that refuel your body cells and discards the wastes. It's normally dominant in the heart and the smooth muscles of the digestive and urinary tracts. And then there's that illustration again that I went over earlier about the dynamic antagonism of these two divisions. The autonomic nervous system function is controlled at several central nervous system levels. So we see the hypothalamus, brainstem and spinal cord, and the cerebral cortex. So with the hypothalamus, the anterior hypothalamic regions direct parasympathetic functions, And the posterior hypothalamic regions direct sympathetic functions. In the brain and spinal cord, the medulla oblongata has centers for heart rate and breathing, and the vagus nerve originates from the medulla. In the cerebral cortex, remembering events can have effects on the autonomic nervous system. It can stimulate the amygdala, which initiates sympathetic response. You can also talk yourself into calming down. Sometimes. Not always. So here we see the hypothalamus, overall integration of the autonomic nervous system, aka the boss. The brainstem, including the reticular formation, etc., medulla oblongata. So there's some regulation of pupil size, respiration, breathing rate, heart rate, blood pressure, swallowing, etc. And then the spinal cord, urination, defecation, erection, and ejaculation reflexes. And so those of you, of course, working in the emergency medical services have probably seen, some results of spinal cord injuries and how it can cause things to happen, inferior to the injury. So, you can see issues with all of these that are mentioned in these reflexes under the spinal cord. So with that, let's take a look at the homeostatic imbalance. So autonomic neuropathy is the damage to the nerves, and it can be caused by alcohol abuse, diabetes, multiple sclerosis, Parkinson's disease, spinal injury. And symptoms are numerous and widespread and usually develop over many years. Hypertension can result from overactive sympathetic vasoconstrictor response due to sustained high levels of stress. Hypertension, of course, can also be genetic. Raynaud's disease is an exaggerated vasoconstriction response and can lead to tissue death because the tissues aren't getting the blood supply. And autonomic dysreflexia is a life-threatening condition that involves uncontrolled activation of autonomic neurons, and it's usually stimulated, by something that's happening inferior to the site of the spinal cord injury. So like a bladder that's full, or a full rectum, or even in a belt that's too tight. The effects of certain drugs and alcohol on the nervous system. So cocaine and methamphetamines can stimulate the sympathetic nervous system. Barbituates depress the central nervous system by interacting with GABA. Alcohol stimulates the sympathetic nervous system but can depress the central nervous system. And beware drug interactions such as painkillers and alcohol, or anti-anxiety and anti-seizure medicines that can lead to coma and death. So I learned once, randomly, in the restroom of a doctor's office, there was a warning not to mix a certain class of drugs that includes Xanax and things like that with, like hydromorphone or anything like that, another class of drugs, because it can lead to that central nervous depression. And then here's a comic for you. Take life as it comes. Run when you have to. Fight when you must. Rest when you can. That's it. Thanks for watching.